In ophthalmology, the term lattice degeneration represents some degenerative changes in the retina. And in this condition, the retina becomes weak and thin, and sometimes structural or anatomical changes also happens, such as this some tear or some holes, or sometimes in severe condition it will become network like holes in between the retinal cells. In a way or other, it is a weakening of the retina and making it thin and inactive in that areas. That is not a simple thing actually, but usually this is seen in the starts in the peripheral area. So vision will not be affected seriously in the initial stage. But in many cases, this will be happening along with some other retinal disorders like high myopia even, where the myopia is very high and the eyeball become more bulging, not bulging but elongated in the position. Then retina also becomes stretched and make some changes in the retinal cells. In such situations, to solve the problem locally or to some limited area will not be a solution. We have to consider the underlying reason or etiological factors for these pathological changes. That is the weakness of retina. So the solution is nothing but to strengthen the retina. According to Ayurvedic theory, Vata comes to the picture. It is a functional factor which, when vitiated, develops these type of changes. So to solve the problem, we have to take the retina as a whole, including its functional and subjective level aspects. And to improve its functional capacity is the aim of the treatment. For that, there are different types of medications, especially treatment therapies, procedures are there. Main among them is Tarpanam. Tarpanam is a nourishing level treatment in Ayurveda which gives more strength or stability to the structures. So if you are selecting the medicines suitable for retina and doing this procedure, that is Tarpana, that will give very good results in the management of lattice degeneration. Also, retina is actually we can say it is a continuation of the brain stem as such. Among the 12 cranial nerves, one is optic nerve, and this is a direct, we can say direct extension of the brain. There is no branches to optic nerve. For all other cranial nerves, there are branches. It will be giving attention or this support to the different structures. But in the case of this optic nerve, it is starting from the brain and ending in the eyeball as optic nerve. Then it becomes the retinal cells. In a sense, we can say like that. So we have to consider the treatment on the head also in the management of lattice degeneration. For that also there are different types of procedures which give nourishment to the optic nerve and directly and indirectly to the retina also. So this Shirovasti, Shirodhara and Labinum, these are the procedures which is suitable for this retina nourishment. So both these sections are equally important. Treatment in the eye, that is ophthalmic medications and also extraocular medications. One is this medicines on the head, and also nasal drops seems to be very fruitful in the management of this type of conditions. In short, the management of retinal lattice degeneration is not limited to the eye. Oral medications and ocular medications and also extraocular medications if you are selecting the medicines appropriately and doing the treatment procedures in its perfect level, then lattice degeneration is treatable, and its result also will be very high. We can avoid mechanical methods like laser treatments and other things. We will give good results from these Ayurvedic methods.